So in this brief introduction, I want to talk to you about why the AHSN Network is involved and interested in the environmental sustainability agenda and how we support it. So the AHSN Network contributes to the Net Zero agenda in 4 ways. We support innovations that directly reduce the environmental harm that the NHS does in delivering healthcare. So, for example, reducing the use of asthma inhalers that contain gases that damage our environment. And if you want a great example of that, you can look at the Sentinel Plus programme over in Hull, which is doing fantastic work. We support innovations that transform pathways and have the side effect of reducing emissions. So it's not their primary purpose, but digital innovation would be a good example of that. If you monitor people at home through digital innovation, they don't need to travel to get to the hospital. We support the supply chain to be greener through our advice and support. And finally, we improve understanding and change culture of staff, patients and their families through learning, sharing and spreading that learning and sharing. So this is why we're interested, and no apologies if you've seen this slide before, because really this is so important. The climate change emergency is a healthcare emergency. Climate change will affect and is affecting our health and well-being in multiple ways. So in England, 892 people died as a result of heatwave conditions in 2019. And climate change will continue to increase the frequency of UK heat waves. We've seen it in the papers over this last week, and I understand that we can expect a lovely day on Friday. Bear with me a moment while I just sort this out. We know that people will die from air pollution. People with having lung conditions, having cardiac conditions from the impact of air pollution, and this is not limited to just our cities, it's also happening around the country. And then when you look at all the things that are on this slide, we can expect poorer mental health from things like war, from the reduced resources that are happening as a result of climate change. It is a health emergency. And this is a cliche, but then it's true. If you do things the same way you've always done them, you'll get the same outcomes that you've always got. So we know that we need to do things differently because the NHS is responsible for 4 to 5% of the country's carbon emissions. And the NHS is doing things differently. So just to give you some examples, and these are one-offs, I know that lots are happening around the country, so please don't feel I'm ignoring anyone on this. The Royal Brompton Hospital sends 0 waste to landfill every year. And if this is a subject that you're interested in, you might want to look at the AHSN Network website, because our next sharing and learning event is all about waste reduction. Harrogate and Bradford hospitals have reduced use of the anaesthetic gas desflurane, stopped it completely, along with many other trusts in the region and in England. Great Ormond Street Hospital have reduced the use of single-use plastic gloves, and that's a massive amount of waste that has been stopped. And in the southwest and Wessex, there is trials ongoing to look at, can we reuse plastic catheters? We throw away 1 million plastic catheters, PVC catheters, every year. So is it safe to reuse them? Is it easy to do? So that's how the AHSNs are involved. And as a little bit about what we're doing. But what I'd like to do is start our discussion by asking our expert panel to briefly introduce themselves and their role and explain the work that they're involved in to support the NHS to reach net zero targets through the use of innovation. So starting over there, Amelia.
Hi everyone, thanks Kathy. So I'm Amelia James, I'm the sustainability lead for KSS and Oxford, and predominantly my role is focusing on how does the network support the NHS reaching their net zero ambitions? And we do this through a few ways. We encourage innovators to start considering sustainability, to start the conversation. We look to encourage the adoption of innovations that have a really positive impact. And we look to broker relationships across different sectors. So that might be academia, industry, the third sector, and really ensure that the network is a catalyst for really good communication, lots of collaboration and sharing best practice.
Hi, my name's Will Udall. I'm an Anaesthetic Registrar in the northeast of England, but I'm also the lead for sustainable healthcare for the northeast and North Cumbria, ICS. What I wanted to highlight, I think, was a specific point where innovation has helped us tackle the problem of nitrous oxide. It's used throughout hospitals and acute settings for analgesia and also anaesthesia, but it's a potent greenhouse gas with a significant contribution. The introduction of Medclare nitrous cracking technology at Newcastle Hospital in the recent 9 months has meant that actually we can hopefully move to really reduce the impact of Entonox in maternity services, and also consider it in other areas such as dentistry and endoscopy as well.
Hi, my name's Frank Swinton. I'm also, as it happens, an anaesthetist, by coincidence rather than by design, I think. But I am also, 2 days a week, I'm the climate change lead at West Yorkshire ICS. So looking at not only the NHS, but the whole of health and social care, and the whole of sustainability beyond the important but part of the pie, which is net carbon zero.
Thank you. Right, so you probably know how this works. To give you a chance to think of some questions, I'm going to ask some questions, and then please do just put your hands up, and we'll bring, I don't know, bring the roving mic to you or something so that you can ask. But starting with Frank, I know that West Yorkshire is really enthusiastic about this agenda as an ICS. So could you tell us a bit about what you've been doing and what's coming next?
Yeah, thanks, Kathy. So West Yorkshire ICS has stated one of its 10 big aims is to be a leader in our response to climate change, and so I was appointed to try and address that aim. And we've spent a lot of time doing engagement work with our staff and our population to try and understand where people are, where they think we need to be, and what they see as being the big issues. And we, on the back of that, one of the big issues that was highlighted was that people didn't feel enabled to make change within their workplace. So we're currently doing a load of work normalising the conversation and getting senior leaders within health and social care in West Yorkshire to be very visible and consistent with their messaging. I was on call last night, so if I'm mumbling my words, apologies. So if anybody feels the urge to have a look at www.allhandsin.co.uk, you can see the sort of thing that we're up to, and please feel free to get involved. We're not overly picky about geographical boundaries. So we've done a lot of that. We've done an awful lot of building networks within the system, because we found that people were working largely in isolation and in silos. So we've created networks of, for instance, pharmacists that are interested in sustainability, and GPs, primary care. There's a sustainability management network. Our board level net zero leads have a network, so we convene all those networks. And of course, importantly, we've done a load of work with the AHSN. And one of the first iterations of that was to have a subset, if you like, of innovators that were particularly interested in sustainability. But this year, we've incorporated the sustainability theme into the Propel programme, because we and the AHSN understand that these two need to be absolutely intertwined and not have sustainability as an add-on or something that's thought about later. It needs to be absolutely incorporated in all change and all practice, but also in innovation thinking from the very beginning.
Thank you. And that does actually, and it wasn't planned, segue really nicely into the question that I've got for Will. So Will, your trust, and you've been influential in this. You said about Medclare, the nitrous oxide cracking technology. What was your biggest challenge in terms of implementing that?
So I know we should never start with apology, but I'll have a qualifier that it isn't just me who's brought this. There's a whole load of people, and I've only really known about this on the periphery. So in terms of a barrier, I think there's as ever, when you bring something new in, there is a challenge probably at every stage. So you need to, first of all, convince people that there is a problem, which I think we've seen that within sustainability for a long time. Convince them that this solution is workable, and then actually try, and then at that point, so if I could pick, I think it's I'd probably say actually even just the nuts and bolts of once you've got people, once you're pushing it on an open door, just trying to get industry to interface with the NHS and everything, because with the NHS, particularly maternity, it's a 24/7 unit. Babies don't stop for us, even if we'd love them to at some time to get some work done. And I think even though we're some way down, we've moved very well forward with this project, I think we're still seeing that, just trying to get actually the nuts and bolts of it into the actual hospital. So if anyone, we are seeing this project being rolled out in multiple places, not just in the Northeast, but around the UK. And it's great to see that journey started. But I think if people are thinking about it, just make sure you've got a good team from all over, including estates, including your medical devices people as well, and have those and really plan for it from the start, before you move forward, because I think that will hopefully help you avoid some of the stumbling blocks of actually how you're going to bring it in.
Fantastic. So set out the problem, convince people the solution is workable, and involve a wide range of people in the planning.
Much better than I said. Thank you very much.
Thank you. And that point about industry brings us on to Amelia. So Amelia, you've come from a different industry to health, and you've been working on sustainability in your previous roles. So what could the NHS learn from other sectors about this agenda and meeting its targets?
Thanks, Kathy. I think that's a really good question, and I want to start by saying I think the NHS can learn a tremendous amount from other sectors, but other sectors can learn a tremendous amount from the NHS as well. I think the perception of businesses and industry has dramatically changed over the past decade, and people in the public now look to businesses to really role model change and actually answer some of the big global crises we're facing at the minute. And because of this, we're seeing a huge influx of indices, reporting standards, benchmarks, frameworks in the private sector, which has really forced industry to look at what are they doing in terms of their strategy, their risk management, their metrics, their data. But there is an absence of such mandates in the public sector. And I think adding more rigor around our data, how we report, manage, will be an absolute step in the right direction. But I would say industry can learn a lot from the NHS as well. The NHS is one of the most collaborative and inclusive environments I've ever worked in sustainability. Listening to these guys, all of the meetings on sustainability I have bring in such a wealth of knowledge and expertise. You'll have sustainability leads, procurement managers, anaesthetists, doctors, nurses. And actually, we really benefit from that wealth of knowledge and understanding. So I think part of the network's role is to understand what is best practice in other sectors and bring that back to the NHS and vice versa, because there is so much that we can learn from each other, and it should be a symbiotic relationship.
Absolutely. Thank you. Any questions from the audience? Oh, one at the back.
Hi, I'm Katie Mantell from UCL Partners, and I've got a question about focus and having the most impact. So I suppose there's a myriad of ways, isn't there? We all need to change to get to the net zero position. I was reminded of a story about the focus on plastic straws, and that actually that's only a very small slice of the plastic used. So my question is, how do you ensure that thinking across the kind of ICS and the health system, you are focusing on the areas, or we are focusing on the areas that will have the most impact? And what do you think would be the 3 things you would like to change that would have the most immediate and significant impact on our carbon footprint?
I'll take that, shall I? It's an entirely reasonable question, and you won't be surprised to hear it's brutally difficult. I think within West Yorkshire ICS, we've taken a very deliberate decision that the ICS climate change team will not be a delivery team. We're an agitator team. I describe myself as a stone in the shoe of the system. Some people see me as more than just a stone, I think. But I think that, for me, normalising the conversation and bringing this onto the radar is a big part of the problem. I don't think we're there yet, which is why we've launched this All Hands In campaign. And I think that, if by chance I happened to be talking to innovators, I would suggest that going forwards, in order to meet our legally binding obligations on sustainability, we need to not only be thinking about and pitching innovations which will make healthcare faster or make healthcare safer or make healthcare cheaper, but it needs to be about reducing our environmental impact as well. So I've got this idea, it's going to improve patient care, it's going to take stress off the staff, it's going to save some money, and it has to reduce our environmental impact as well. Because otherwise, with clear conscience, the NHS cannot buy it, because we know that it takes about 12 to 15 years to bring an innovation to widespread practice. In West Yorkshire, we're committed to net carbon zero by 2038, which is 16 years away. So, and therefore, every single decision we make across the whole of health and social care needs to be shooting towards that goal, starting today, or we're not going to be there. And so, and therefore, it's that agitation, network, normalise the conversation in order to have the ripple effect that will reach the whole system, because there's no way I can do it or you can do it on your own.
And that does, it does raise an interesting point about we talk about net zero, but that's not the only environmental impact that is out there. You're talking about plastic straws, plastic waste. Yeah, we need to think about more than just net zero, despite the fact that the targets are for net zero, in my personal opinion. Yep. Will, did you want to come in there too? Oh, sorry, was it Amelia? Sorry, I just saw a hand in my peripheral vision.
At all. I think it is a brilliant question, and I think in the space of sustainability, there is so much to do. So the NHS, they're delivering a net zero strategy. It was only released a year and a half ago, so we're right at the beginning of the journey. But for me, there's kind of three focuses. I think it's about leadership. This needs to be coming from the top. I think it's about education. People need to understand what the net zero strategy is and how they can be part of it. And it's about communication between the different ICS and the trusts. But we need to set sail and build the ship as we go, and there's no silver bullet to doing this. But I think the focus and priorities that you mentioned is absolutely key.
Did I see a question here?
So obviously with bringing in new technologies or a new way of doing things, there's often a cost implication or an impact on the service. So one, is there a framework to sort of evaluate how those things interact? And two, do you think the sustainability goals are high enough in that hierarchy when competing factors are, especially with cost and impact on service at the moment being particularly acute?
It's a really good question. I think it's about the 3 C's, isn't it? Care is fundamentally the most important, and this is one of the tensions I've come across coming into healthcare, is that patient outcomes is absolutely the most important thing, but then it's also about how do we reduce cost and how do we reduce carbon. And I think from my experience, the expertise of bringing so many people and stakeholders into the conversation will result in better outcomes, but the difficulty is patient outcomes has to be the priority because we're a health service, but we're definitely bringing in these other factors and they are climbing the agenda. I saw it in the private sector, climbing to the top of the corporate agenda, and they absolutely are going to have a place in the NHS. You can see it now, and the amount of people that are here today to listen to sustainability, the fact that we've got a sustainability healthcare zone is kind of a big indicator that we're moving in that way. It's just going to take some time, I think.
And I think I'd just add, I think if you talk about metrics, you can also play things like the Centre for Sustainable Healthcare and the Faculty of Sustainable Healthcare with their Sustainable QI projects. We talk about, it doesn't give you a percentage outcome, but if you look at patient benefits and then you take that over the triple bottom line of environmental costs, social costs, and your economic costs, that gives you a framework to work from. In terms of how to evaluate any new service that you bring in. And I think if you think of it in that form, you can then consider, okay, how do we weight this? But that would be a further discussion within each, what the priorities are for each local area.
Thanks. So I was to add, really, I think if you're making a pitch, then the two common ways of demonstrating sustainability change and advantage would be against the UN Sustainable Development Goals, and donor economics is the other really big one, Kate Raworth's work. And the other thing to say is exactly as you described, is that I know that there's a hospital near me that has changed its procurement and tendering process to include sustainability in the first stage of its tendering process, because the second stage always goes down to price. So they've moved sustainability into the first stage. So you've got to get through that gateway before you can start talking about price. So it is happening.
Thank you.
Yeah, thank you. So my question is, I think it's a good follow-on from that, really. When we're talking about innovation, how do you validate the claims that are being made by suppliers about the reduced environmental impact of their products, and how are you tackling greenwashing?
So I could probably come in on that if that's helpful. So that's a really good question, and we do see this, and there's a plethora of tools and calculators out there that could be used that will all give slightly different results, and maybe you can pick and choose which one you want to get. So what we advise people, innovators, is to pick one and use it consistently. That way we can see the impact that has been had over a period of time if you're looking at reducing your impact. The other thing is that we're doing some work with NHS England around looking at how do innovators calculate the impact, where are the gaps, how can we be sure that people aren't just picking a figure out of the air? So I guess the short answer to your question is, at the moment, we can't be sure, but there is work in place to try and help us to do that. I don't know whether colleagues want to come in.
Well, I was just going to say, as I'm sure you know, if you scratch the surface a little bit, it's very often very obvious that you're having the wool pulled over your eyes. You know that, Claire.
Okay, so a question over there, and then I think we've got a question there.
My question is, do you think, given that so many other organisations, local authorities, communities have been on this agenda for such a long time, do you think that we kind of think of ourselves within an NHS envelope when actually there's lots and lots of help and support from other partners within communities who've been on this journey for 20 years? And I agree with the point that you're making, that this is not just about net zero, it's about a sustainable development lens that drives up communities' lives, people's lives, the people we work with lives, to take those back into, so it's a mindset. So how do we really be part of everybody else's movement and let them help us, is really my question.
So in West Yorkshire is all I can talk about. That's where I work and live. The climate change team sits within the ICS, within the broader Improving Population Health Board. And we have a joint appointment of a consultant in public health across both the ICS and West Yorkshire Combined Authority. And within her remit is also climate change. So you're absolutely right. We have not cracked it by a long shot, but it is absolutely on the agenda, and we're doing what we can. And it's vitally important. More and more and more of that, I think, we need.
I think it's a really good question, and I tried to touch on this slightly before, but I think we do need to broker relationships across so many different sectors. This is academia, this is the private sector, this is the third sector, all charity, volunteering work. Part of our role is to kind of bring people together and collaborate, but it's really, really difficult. And I've already, so there's actually someone in the audience, say Dean, who I've worked with at Salesforce, and we've actually had conversations, and we've brought the network, Salesforce, and the Greenham NHS team together to look at how can we actually start addressing some of the challenges, what are the solutions out there, because there's not one industry or sector or business that can solve this. And I really agree with your other point. We're living in a time of intersecting crises as well, so it's not just the climate crisis. We're witnessing heinous racial inequality, economic and political uncertainty, and actually they need to all be addressed together, but it's a really difficult challenge. And I think we're all just beginning to start seeing how immense this journey is going to be in front of us, but we're on the journey. And all I can say is, being part of the NHS, there is so many passionate and motivated people who want to make that change. And I really believe we will get there, not overnight, and it will take years and years, but I believe we will get there.
Thank you.
Thank you. I'm interested in how you identify and then prioritise where you're going to spend the time. Where do you make the biggest impact for the changes?
So I can say, so from our point of view, so as within sustainable healthcare lead up in the North East, North Cumbria, that's a fairly new role. I've been in it about 4 months, and we've been talking, we start with what are we going to do? And I think from our side that we said, do something, because the groups that we're working with are newly formed. We're working, often the job hasn't existed before, and I think to start with, we just wanted to see how are we going to move forward, how are we going to interface with people, who do we need to interface with, who are the stakeholders, and there are some obvious things, such as high impact areas like inhalers, volatiles, anywhere there where you use it a lot is probably where it has a high impact. So if you can think about what most people are unwell with, wouldn't be a bad place to start. But in reality, I think just get going with something, because that will, people will build around that. If it's recycling, even though it has a low impact, it's a visual thing and it gets people involved. And that's almost like a gateway drug for people to then say, right, I've done some recycling. What next? Where else can I do? Where is the next thing? And that's probably how we took it forward in the Northeast. But there are ways you can start to, if you want to pick something.
Yeah, I think, at danger of sounding my age, for the first 10 years I was working on this, the answer was that I'm pushed against any door that was open because they were few. Since about 2018, there's definitely been a societal shift, and now it feels like pretty much every door is open, and so that strategic prioritization has become much more necessary, and we have not got it right, but there's a bit of going with part of the issue, I think, is that there is so much work to do. It's like, it's a little bit like trying to choose which butter you're going to buy in the supermarket. There's 800 different options, or which phone contract you're going to go with. There's a million different options, and how do you choose one from the other? And you never really know which one's going to bear fruit. So we've sort of spread bet a little bit, and sometimes we've gone with the things that we think might be harder work but might bear more fruit. For instance, staff transport. Sometimes we've gone at the things that are obviously a really easy quick fix and will give us a bit of a confidence boost and will create some good publicity. Sometimes we've gone at things that are really specifically, really obviously easy to fix and creating huge harm, and stopping the use of desflurane as an anaesthetic vapor is a very obvious case of that, because it's a very easy straight switch for a much less environmentally damaging alternative.
I think it's a really good question because prioritisation is probably one of the hardest part of our jobs. I'd say, speaking from an academic health science network perspective, there's two things that I think we really aim to focus on. The first is sharing best practice. So my colleagues, including Kathy, have run a series of really successful Learn and Share events, which have been attended by over 1,000 employees from the NHS. And it's been brilliant because as a trust or an ICS, you might think we're quite good at travel and transport and estate, but we don't know what sustainability means for food and nutrition or sustainable models of care. And if somebody from one of those trusts who's doing it really well can come and share their experience and their journey and what they're doing, that's really useful. And I think the other thing we do really well is net zero. Getting us to net zero will be really hard, and we're going to need transformative change, and likely that will come through innovations. So we spend a lot of our time supporting the innovators, understanding what sustainability means for them and them on their journey through the procurement in the NHS, but also helping spread the adoption of innovations that have a really positive impact. And I think overall that will be really vital to the NHS achieving its ambitions.
Thank you. And I would just add to that and say that I was surprised to find that the number of NHS staff who actually know that the NHS has targets, that the NHS does harm in this area and is doing something about it is really low. It's something like 27%. So anything that will grab staff attention and enthusiasm, and you can harness that, is going to make a difference. Thank you all so much. It's been fascinating to listen to you. Thank you for coming along. Thank you very much.